PCOS is on the rise, and you might be wondering, can you get PCOS after having a baby? Well, we're talking about this and more today. I'm Dr. Perkins, a board-certified OBGYN, and I'm so excited to educate you more about your body. Come on, join me in this conversation today. By the end of this video, you'll have a better understanding about PCOS, how PCOS is affected by birth, and understanding how exactly do you get PCOS after having a baby. So let's first talk about what is PCOS. PCOS is Polycystic Ovary Syndrome. This is a diagnosis that means that you had 2 of 3 possible symptoms that gave you the diagnosis. These symptoms are the first, anovulation. This is a medical term that means that you're not ovulating or you're not ovulating regularly. With that, most people will have less than 9 periods per year. Understand that if you do not have ovulation, you will not be able to have periods. One thing leads to the other. You will not have periods unless you ovulated and sperm did not meet with an egg to cause fertilization to occur, and therefore your body clears itself, resets itself by having a period. The second step to diagnosing PCOS is checking the levels of androgens in your body. This is a blood test. Some people may note that they have high levels of androgens, which are also noted to be male type of hormones, which normally would be in a female system but in a very small amount. With people with PCOS, that level may rise. For instance, you may have high levels of testosterone. Some symptoms of having high testosterone may look like having hair on your upper lip, hair on your chin. Sometimes overall on your body, you may notice more coarse, thicker hair growth. Some people may have it on their chest, their thighs, their arms, all of the same, in a pattern that is very similar to that of a male. Some people may also have male pattern baldness in the top of their scalp, in the front sides of their hairlines, things like that. These are subtle signs that you may have an overabundance of testosterone in your body. Thirdly, you may have polycystic ovaries. Now, PCOS was initially founded on the fact that each person with this diagnosis had polycystic ovaries. But what we've learned is that you can really have any combination of the 3 things that I just mentioned: not ovulating regularly, having high testosterone or androgens, as well as polycystic ovaries. If you have the first 2 factors, literally you can have PCOS without having any cysts on your ovaries. But let's talk a little bit more about what that looks like. In order to know that you have polycystic ovaries, your provider will order a transvaginal ultrasound or abdominal ultrasound. The difference is that an ultrasound on the abdomen is kind of further away from the ovaries and doesn't give us as much information as having a transvaginal. Literally means that the ultrasound probe will be placed inside of your vagina, which ultimately will be that much closer to your reproductive organs and to your ovaries, which will give us more data. Upon looking at your ovaries in this ultrasound, the sonographer will count the amount of follicles that they see in each of your ovaries. In each follicle is 1 egg. This is how the egg matures and prepares for ovulation. In a normal reproductive female with optimal fertility, the amount of follicles would be somewhere between 8 and 12. In someone who is perimenopausal or close to menopause, those follicles may reduce down to 2 or 3. If a person has early menopause, this may happen where the numbers are on the lower side, or in somebody with PCOS, polycystic ovaries, we often will note that the amount of follicles present can be as high as 20 or 22 in each ovary. Now, you might think that having a lot more follicles means that you are a lot more fertile and this is a wonderful thing, but not in the case of PCOS. In PCOS, many follicles are maturing. However, they don't complete maturity and therefore remain inside of the ovary stuck. This is the reason why so many follicles are seen on ultrasound. I'm loving our conversation so far, and I hope you are too. If so, subscribe to this channel and please leave a comment below. Now we've talked about how PCOS is diagnosed, let's talk about when this can occur in your system. PCOS can happen as early as a teenager, literally very close to the time that puberty has happened, and it can happen as late as towards menopause. With that, we know that PCOS is caused by a hormonal imbalance. That means that all of the different organs inside of your body, they're not optimally producing the amount of hormones they each individually are supposed to produce. In general, hormone production starts in the brain. It starts in the hypothalamus and in the pituitary, and that starts the communication system that then transcends to the rest of your body, to your organs such as your ovaries, your uterus, your kidneys, your liver, your lungs, literally all of your organs. We as females have more than 50 different hormones in our bodies. For them to work well together and to help you to have the best body ever, they need to communicate equally and appropriately with each other. In PCOS, that isn't occurring and can cause you to have many other symptoms of PCOS, such as infertility, weight gain, and many others. PCOS is really a long-term diagnosis. If you have this diagnosis before giving birth, then yes, PCOS will continue after birth. If you've never had PCOS diagnosed after birth, you may notice that in addition to all the hormonal changes and roller coaster changes that happens in your body around that time frame, you may develop PCOS as a new onset. The question is, did giving birth cause you to have PCOS? The likelihood is no. However, PCOS might have been in your system prior to being diagnosed and prior to you giving birth, and giving birth may exacerbate the symptoms and make it a little bit more pronounced. Initially, you may note that your periods might not come back. I've seen this many a times. So you have your baby. Normally, you will get a period again 6 to 8 weeks after giving birth. However, in a new onset of PCOS, you may not get cycles at all after giving birth. This would warrant further testing by your doctors to see why is it that you've now had this new onset of not getting your periods, or having this excessive growth that comes from having high testosterone, or having polycystic ovaries as well. With that, they'll check your hormones with blood tests. They will rule out other problems that can occur that cause problems with PCOS or any of the symptoms I've mentioned so far in this video. Testing is very important because with testing, we get answers. One important note that I'd like you to know about giving birth is that in general, it takes 3 months for your body to normalize its internal hormones with estrogens and progesterones. Outside of those 12 weeks, if you're having any symptoms that I've talked about today, it is important to get tested and talk to your doctors about this. You may also be wondering, is there anything that you can do to help to prevent this from happening and to balance your body and your hormones a little bit better? Yes, I do have a few tips for you today. After having a baby, I recommend that you focus on your diet, eating well, and eating clean. What that means is that you want a diet that is rich in vegetables, especially green vegetables, as well as removing dairy from your diet for a lot of reasons, which I'll tell you about in a little bit, but also incorporating lots of movement and activity once your doctor clears you for movement. That means being physically active, exercising, doing strength training, moving your body, which helps a lot with balancing your hormones. I have a free gift that I'd like to offer you today, and it helps with balancing your hormones, especially after giving birth. This is my free ebook on my website called Hormones Don't Lie. In this, you will learn strategies and more details about what to eat and how to move to help you balance your hormones. I hope you've enjoyed our episode today. It's been a pleasure as always. I'm Dr. P. Thank you for being here, and see you next time.